to the Senate Health and Human Services hearing for Monday, May 3rd. Can the clerk take a roll for the purpose of a quorum?
Senator Miller.
Here.
Senator Valverde.
Here.
Senator Lawson.
Here.
Senator Bell.
Here.
Senator Calkin. Senator DeMario.
Here.
Senator Golden. Senator Paolino.
We have a quorum present, so the first piece of business I'd like to get through is we have a few bills posted for consideration. So the first motion for passage would be on Senator Gallo's Senate Bill 302. We had the full hearing on last week on step therapy protocol that we have considered in several past years also. Motion for passage
So moved.
by Senator Valverde, seconded by Senator DeMario. Can the clerk please take the roll on this bill?
Senator Miller.
Yes.
Senator Valverde.
Yes.
Senator Lawson.
Yes.
Senator Bell.
Yes.
Senator Calkin. Senator DeMario.
Yes.
Senator Golden. Senator Paolino.
Did you get that?
Yeah.
With six yes votes, that bill will be brought to the floor. The next bill we have is Senator Amori's companion to Senate Bill 384 that we previously passed. I think it was Senator Archibald's bill, Senator Lawson's bill, I'm sorry, on chronic and intractable pain. Can the clerk, before we need a motion, I'm sorry, motion for passage.
So moved.
Second?
Second. Do we want to bring forward the sub A?
I think, yes. A
So I move we indefinitely postpone 5247 and bring forward 5247 sub A.
Second.
All those in favor? The
Aye.
clerk?
Senator Miller.
Yes.
Senator Valverde.
Yes.
Senator Lawson.
Yes.
Senator Bell.
Yes.
Senator Calkin. Senator DeMario.
Yes.
Senator Golden. Senator Paolino.
Yes.
Thank you. We have 6 in the affirmative on that. The next we have House Bill 6014, which is the companion to Senate Bill 713. Oh, I'm sorry. I'm way ahead of myself today. So can we have a motion on 52747 sub A?
I move passage. Second.
Roll, please.
Senator Miller.
Yes.
Senator Valverde.
Yes.
Senator Lawson.
Yes.
Senator Bell.
Yes.
Senator Calkin. Senator DeMario.
Yes.
Senator Golden. Senator Paolino.
Yes.
Now we've properly voted that to the floor. Next we have House Bill 6014, which is the companion to Senate Bill 713 by Senator Goodwin, Office of State Medical Examiners, which removes the sunset for the medical examiner's review of drug-related overdose deaths. Is there a motion?
So moved.
A second? The clerk?
Senator Miller,
Yes.
Senator Valverde,
Yes.
Senator Lawson,
Yes.
Senator Bell,
Yes.
Senator Calkin, Senator DeMario,
Yes.
Senator Golden, Senator Paolino,
Yes.
We talked about it last month, page 6.
Thank you. We have 6 in the affirmative on that. And now we have bills for hearing. Before we take them in order, I want to give the senators who are present currently, I believe we have Senators Lombardi and Senator Oyer. I want to take Senator Oyer first just because I know she has another hearing that she's scheduled to also introduce a bill on. And Senator Oyer, I believe you're present to talk about Senate Bill 493, the Hospital Conversion Act.
I am. Thank you so much, Chair. So this legislation I have introduced actually for a few years now in order to strengthen the Hospital Conversion Act. And I will say that, you know, while I originally introduced this bill, it was on the heels of the Memorial Hospital conversion conversation. And so the fact that it is now, another legislation that is kind of ripe for discussion at this moment, with everything that has just been happening and the conversations with Prospect. What this legislation would do is it restores the Health Services Council to its original composition. During the Memorial conversion, that committee was pretty much cut in half. This would allow members of the public to be put back on that council. It also requires full disclosure for applicants with regard to, employment, retirement plans, pension plans, dental plans. How will those be preserved by the acquirer? As we know, there's been a lot of discussion about pension plans as part of these conversion conversations. And so it's requiring acquiring entities to make minimum investments into these benefits. And it also requires disclosures around how long those services and services of the hospital facilities will be maintained by the acquiring entity. So, and then the other thing that I think is really key, especially given the conversations in the last couple of weeks between the Attorney General's office and Prospect, is the disqualification if the applicant is not forthcoming with state regulators during the application process. So, this is a bill that I've worked on with UNAP for a number of years, and, I'm happy to answer questions. I believe their general counsel will likely be on as well testifying to this legislation, but I'm also happy to answer any questions.
Any questions of the sponsor from the committee? Thank you. Senator Bell does have one.
I just want to very briefly thank Chairwoman Oyer for introducing this legislation. It is very important to my district where we are facing potential job losses as a result of what's going to happen at Roger Williams and Fatima, where many of my constituents work. It is very important that we apply much greater scrutiny of corporate health care, and I think this piece of legislation is an important step forward. So I just want to thank the Chairwoman for putting it in.
Thank you.
I want to thank her for the same reasons that Senator Bell thanked you. So, any other questions from committee members? If not, I believe the next senator who is present to discuss and introduce his bill is Senator Lombardi.
Thank you, Mr. Chairman, ladies and gentlemen of the committee. This bill, as you can see from the explanation, seeks to do a couple of things. But first, it seeks to rename the Ambulance Service Coordinating Advisory Board to the Ambulance Service Coordinating Board. This board has approval powers over regulations, protocols, standards used by the Department of Health, minimum standards, licensing fees, restocking, and all other issues as it relates to the area of emergency services. The board has been around since 1973, and there has been some 50-year relationship between the Department of Health and this board of collaboration, coordination, and working together hand in hand to see what the best possible protocol is to address emergency situations. It's a 25-member board, and it's made up of residents from the Leagues of Cities and Towns, the Fire Chiefs Association, firefighters who have certified emergency medical training, and both paid and volunteer types, emergency medicine and pediatric doctors. Private ambulance companies have a seat at the table, hospital representatives, and members of the public. And the board throughout has streamlined and worked to approve recommendations that are related to emergency services division, right up to like stocking an ambulance and to the proper medications on a rescue, that sort of thing. Apparently, in January of 2021, that 50-year history came to an abrupt halt when the Department of Health instituted unilaterally certain changes, and it's my understanding that two of these changes, one involved the immunization protocol during COVID, and the second involving the types of medications administered during a cardiac event, vis-a-vis the protocol set forth by the American Heart Association. I would point to you that they had a meeting, that is, this board had a meeting to determine what, if anything, is the Board of Health's, Department of Health's decision going forward. And at that meeting, they were told that they would make no decision relative to cooperative efforts until their June meeting. So this legislation represents a collaboration, and in my ninth year now in the Senate, and those of you may know, I've supported some pretty significantly newsworthy legislation involving firefighters. This one, I can probably say for the first time, is supported by the Leagues of Cities and Towns, the Rhode Island Fire Chiefs Association, the Rhode Island State Association of Firefighters, and the chairman, vice chairman, and secretary of the advisory board. And parenthetically, many of the vocal members, many of mayors who were vocal in the past also support this. And these entities are here, this entity's here to provide emergency services for Rhode Island and to manage and provide the best possible services and materials when it comes to favoring legislation. So what this legislation does is it codifies what has taken place for the last 50 years and suggests that now that the board does not have power over the Director of Health, but instead the Director of Health will act in agreement with this board to manifest the most possible best protocols and implements. I would point out that this is, I think, in a more novel sense, it is allowing those best suited to make the determination and to have a seat at the table to make that determination. And that's all this does. I've received calls that somehow we're trying to overstep the authority of the Director of Health, and that's not the case. This is just to work in conformity with the Department of Health. And I'm certainly here to answer any questions if I may.
Before we get to questions for Senator Lombardi, I noticed we've been joined by Senator Gallo. Senator Gallo, did you come on to comment on the passage of your 302?
I did, Chairman. I just wanted to thank everyone. This is so important to all the people that have to go through all those steps, and it makes such a big difference in their lives. I can't thank you enough for listening to everybody that this is important to, and not having them spend years going through these steps. and helping them to get better and live their lives and have productive lives and be able to get a cure. And I want to just say thank you, that's all. Thank you.
Of course, you're welcome. So, are there any comments for Senator Gallo before we move back to Senator Lombardi? Thank you for coming in. Senator Lombardi, I believe it was 2 years ago that we had a bill that added membership from the fire departments. Was it 2019?
Yes, it was, Mr. Chairman.
So it was very effective in giving them a louder voice within the current structure of it, and I believe that was the intent. This seems to go another step further, and I know we've all gotten correspondence around this bill, and it seems that those are concerned about it have consensus that restricting the authority of the DOH within the committee might be bad timing, considering what we just went through and how important their advice can be.
Understood, and that is some of the brushback that I've gotten.
Yeah.
But I can tell you that the impetus for doing this involved that very same situation. There was an immunization protocol that was put in place that eliminated EMTs and advanced EMTs from administering the vaccine. That very protocol, that, for lack of a better term, that unilateral protocol by the Department of Health was actually revamped and changed when there was this outcry that these, we need EMTs and we need advanced EMTs to be doing this. And so their own little policy happened to be changed by virtue of the fact that this board stepped forward and said, hey, you did this, what about the EMTs? And so they actually changed their own decision that they made, like within a month of making that first decision, if that makes sense to anybody.
Yeah, I mean, we've now received, I don't know if you've got it in time, but we received a letter from Department of Health with real concerns about the legislation, going far enough to use language such as this bill would set a terrible precedent for several reasons, and that the powers be granted under this legislation are incredibly broad and affect some of the fundamental aspects of emergency management. So I do think before we, go ahead and consider this, we have to have a further conversation with the Department of Health. And also, I don't know if the senators or the sponsor have referenced or had time to look over the letter from Dr. Otis Warren, who's president of the Rhode Island chapter of the American College of Emergency Physicians, who has similar concerns. And I think one of the concerns, at least from me and possibly other committee members, is the rescues are delivering to emergency room doctors, and to not have the cooperation or understanding or the partnership with those who are delivering it to seem to have concerns as at least as important as the Department of Health concern. And what my worry about this is what I just explained, is the rescues are going to the emergency room, and the emergency room doctors who you're handing these patients over to have concerns with the legislation. It seems to be, it would be nice to, I assume they'll be on discussing the legislation later, but it'd be nice if there was some discussion so there was more consensus. We never get rid of everybody's concerns, whether it be the Department of Health or the emergency room doctors who have concerns, but I think we have a ways to go to at least consider their issues.
Well, Mr. Chairman, I would never be presumptuous to think that this bill was going to get approved tonight. I certainly would anticipate that it would be held for further study so that all the participants would be able to hone in on this. But I will tell you that many of the Rhode Island emergency physicians already have a cooperative situation going on with the rescue services. and there's sort of a quid pro quo whereby these emergency doctors serve as directors, put that in quote, of their various cities for emergency services. In exchange, these rescue runs are then occupied by young and aspiring emergency room physicians. So there's certainly, it's not a lack of cooperation between the two. I would say just the opposite there is. And I understand that the emergency physicians as a group may have an issue, but certainly that's something we can discuss down the road.
Thank you. Senator Bell has a question for the sponsor, I believe.
Yes, and I think you could probably imagine what my question might be, but, as you know, we have the Separation of Powers Amendment, which changes how the Constitution of State Boards operates. And I'm coming increasingly to the viewpoint that it may have gone too far, and we should be able to do things like this, and there shouldn't be a constitutional issue. But we have the Constitution that we have, and we have to follow it. So, looking at this legislation, one of the things I think it does unambiguously is changes this from an advisory board to one that does, in fact, execute executive authority. And it seems to me that that would then place it under Article 9, Section 5, which would have, I think, two important implications, one of which would be that every member of the board would therefore be subject to advice and consent of the Senate. And another one would be that we could not place restrictions on whom the governor could nominate that are as restrictive as these current restrictions in the statute. So, and I'm not necessarily saying that that would be a bad thing, or a reason that we can't approve this bill. But I do think it's sloppy for us to leave legislative language in place that is unconstitutional. And if we do pass this so they have executive authority, I think it would be preferable if we then align the statutory language with the requirements that would become in effect for constitutional reasons. So my question is whether you'd have any objection to that. Have you thought about the constitutional implications of triggering Article 9, Section 5? Do you think Article 9, Section 5 might not be triggered for some legal reason? So I was wondering if you could comment on those dynamics here. I'm not sure it's a reason to not pass the bill, but I do think it's a concern that possibly should be addressed in terms of cleanup language. I think you're muted, Senator Lombardi.
I apologize. It's not often I'm muted, Sam, but in my opinion, to answer your question, I always, anytime you have an agency exercising some degree of authority, you always have to look at the separation of powers issue. I looked at it a little differently than you did. You looked at it in terms of if it is, so I looked at it from its infancy. Does this board, as it exists now, create an administrative function and therefore is somehow violating the separation of powers as a legislative body trying to legislate it? I didn't think through your thought process about whether it's advice and consent or otherwise. I will tell you, it's certainly any time we deal with an issue of separation of powers, we have to give a very significant look at that. And given the fact that this bill was initially drafted last week and brought before this board this week, it's certainly something that I would look to and meet with lead counsel about in both respects, both my concern and your concerns. But it's well taken.
Thank you so much, Senator Lombardi.
Thank you.
Any other questions for Senator Lombardi? We will have some public testimony later when we get to that on this bill also.
Thank you for your time.
Yeah. So before we finish with introduction, Senator Valverde has Senate Bill 648, if she wants to give a brief explanation before we go on to the telephone.
Sure, thank you, Chairman. So this bill would add medical directors or their designees to the list of those individuals to whom disclosure of information contained in any prescription drug database is allowed for quality improvement activities within the practice. This bill is supported by the Department of Health to improve prescription drug prescribing activities within practices.
Any questions for Senator Valverde on that bill? So next, I want to give a brief explanation before we might hear from others on the phone about Senate Bill 714, Restroom Access Act, which creates or would allow under certain circumstances customers with an eligible medical condition to access retail establishments' bathrooms that are not normally accessible to the public. And it includes liability protections for those retail establishments and their employees. This bill came from those who have very specific conditions which would make use of a bathroom more urgent than others. And my experience as somebody who has bathrooms in their place of business is that this has become more complex and relevant under pandemic conditions, and that the access to public bathrooms is seriously diminished under pandemic conditions. And we're almost through this one, it looks like, but we should have this kind of legislation in place for any similar or potential repetition of what we're currently hopefully phasing out of. Any questions on that bill? So if not, we can now go to calls, and I believe the first person we'll try to connect with is John Potvin from the American Heart Association on Senate Bill 385. Mr. Potvin?
Yes.
You're on with the committee. Go right ahead.
Hi, Mr. Chairman. I am actually testifying on 385 and 860. Would you like me to testify on both of them now?
Yeah, you can do both right now.
Okay. All right. I will start with 385 then. Mr. Chairman and members of the committee, thank you very much for your time this evening. My name is Captain John Potvin, and I am the Director of Emergency Medical Services for the City of East Providence. I'm a firefighter and a paramedic. I also serve on the state's advocacy committee for the American Heart Association. I'd like to thank Senator Goodwin for her leadership on this critical issue. Each year, an estimated 350,000 sudden cardiac arrest events occur in the United States in and out of hospital environment. Without the quick intervention in the form of cardiopulmonary resuscitation, otherwise known as CPR, and defibrillation, death from sudden cardiac arrest is certain. Sadly, and most importantly, only about 10% of these victims survive this dramatic event. Early bystander CPR approximately doubles the chances of survival from cardiac arrest, and that's why this bill is so important. An effective way to ensure that CPR is provided quickly is for emergency telecommunicators to provide instant instruction over the phone. Telecommuter CPR, or TCPR, allows bystander CPR to begin, and it works by keeping the brain and heart alive until EMS arrives to provide defibrillation and other vital interventions. TCPR can assist the untrained caller as well as remind the CPR-trained caller how to provide high-quality CPR during a difficult and often frantic time. And that's a very important point. Simply put, TCPR saves lives. Telecommunicators are the true first responders and a critical link in the cardiac arrest chain of survival. A telecommunicator can be the difference between life and death. Telephone or telecommunicator CPR should be the standard of care for every 911 communicator that provides dispatch instruction for emergency medical services. Thank you for your consideration. I hope the committee will support Senate Bill 385.
Can you just remind me again, you're a volunteer for the Rhode Island Medical Society, and you also work as a fireman in East Providence?
So, yeah, so I'm also a member of the advocacy committee for the American Heart Association.
Okay. And an
Not
East
the
Providence
Medical Society.
firefighter?
Correct.
Okay. So I know there's a conversation in Providence, and it was even part of their budget, to look at models, and I've worked with Chief Kenyon on this. They're models to have mental health workers as responders in certain circumstances, similar to several other towns, such as Denver and Portland, the Cahoots model,
Yes.
which might be something we consider, some kind of potentially additional language in here to have emergency medical dispatch prepared to be able to properly triage that kind of calls when and if those programs get involved. I just wanted your thoughts on that idea.
Yeah, so I think right now, for many cities and towns, one of the biggest complexities is that there is no emergency medical dispatch being performed. So trying to stratify and, triage those calls is very difficult when you don't have folks that are trained to be able to weed them out from a telecommunicator standpoint. I think, as I stated, one of the very first steps and one of the very first responders is the person that answers the phone. So I think anytime that we look to any of those types of systems, we have to first and foremost look at dispatch and what's our capability to make sure that the sickest people get the first ambulance, and then to your point, sir, to make sure that they get the most appropriate care.
Yeah, so I was wondering maybe we could put language in here to just have emergency medical dispatch to report on what upgrades and in both personnel and training and any hardware or software upgrades they would need in order to properly serve those types of models.
Certainly, I think that that's something that the American Heart Association, as well as other entities, could do to make sure that the wording is correct, to make sure that the equipment as well as the training is there and capable of handling that.
Yeah. Thank you. Did you want to, are there any questions on Mr. Potfit's testimony on 385? Do you want to go ahead on 680 then?
Excellent. Thank you again, Mr. Chairman and members of the committee. As I previously stated, my name is John Potvin, and I am still a captain and director of emergency medical services with the East Providence Fire Department, where I've been a firefighter and paramedic for the past 23 years, and I currently serve as the director of emergency medical services for the past 17 of those 23 years. In addition, I have been a member of the Rhode Island Ambulance Service Coordinating Advisory Board for the past 10 years, and I have served as the chairman for the past 3. And I'm here today representing myself in the leadership of the board, but not the board itself. So I'm here to speak in support of Senate Bill 860. In an effort to save time, I will be speaking on behalf of the other 2 Ambulance Service Advisory Board officers, Vice Chairman Michael DeMello, who is the chief of the Bristol Fire Department, and Board Secretary Raymond Medeiros. Since I've been a member of this board, any changes proposed to the protocols or the rules and regulations of how we deliver emergency medical services to the citizens and visitors of Rhode Island have always come before the board for vetting and approval. That changed this January when changes were made to the protocols without the board's knowledge. I, as the board chairperson, did not find out until my fire department received an email from the Department of Health, along with all of the other pre-hospital providers, as to what the changes were. I'm here to tell you that the present system of having the board's professional insight and professional opinion has worked. I've seen firsthand the good work of this board. I've been in the committee meetings, vetting the issues and how dedicated these board members are. Doctors, nurses, city and town representation from both the Senate and the House, fire chiefs, emergency medical technicians, both paid and volunteer, as well as representatives from private ambulance services and hospital reps and members of the public. In true fashion, the ambulance board is a multidisciplinary team with representatives from the emergency services field and medicine who serve on the board to make a difference. And their opinion should matter, and that's what this legislation will do. In closing, I want to tell you about a call I received this weekend. A colleague of mine in the medical profession had received correspondence from a doctor whom I'm sure might be testifying tonight. That correspondence said if this legislation passed, it may jeopardize the protocols governing the transport of heart attack and stroke patients. That simply is not true. For the record, it was the board that approved those heart and stroke protocols when presented to us by the Director of Health. This legislation in no way puts those two protocols in any jeopardy. As we sit here tonight, the only person who can propose and implement emergency service protocols in the state is the Director of the Health Department. This legislation does not change that. This legislation does not grant the Ambulance Service Advisory Board the power to propose or implement any future protocol changes, nor change any existing protocol presently in place. Only the Director of the Health Department has the power to do that now, and that does not change if this legislation passes. This legislation simply codifies in law the practice we've been following for years, since I believe the board's inception in 1973, and maybe more importantly, a practice that has worked over the past decade. Thank you.
So I discussed this some with Senator Lombardi. It at least concerns me as chairman, that we seem to have so much conflict, either perception or the actual language, that concerns both the emergency room physicians that are inevitably part of the process that a rescue will go through, and the Department of Health, which would also be an integral part of the public health continuum that includes rescues. And it concerns me that we have we're still left with very serious concerns from both of those groups, the emergency room physicians and the Department of Health. Do you think we need to work a little bit further, at least until we have a better understanding from them on the implications of this legislation?
Well, and I can see why, sir, why you would make those comments and have those concerns. Certainly relevant. I think what I can say to you is the ambulance board is made of 25 members, which includes 4 doctors, and it also includes a public forum because we fall under the public meeting standards, where any physician or any provider or a survivor or patient can come and be heard to help implement change. And as I said, there's 4 physicians that represent surgery, representing trauma, pediatrics, emergency medical physicians, and also the Rhode Island Medical Society, that all have a voice on that board. If the ambulance board was not to be taken into consideration when decisions were being made, it would basically usurp any voice that any entity besides the one physician medical consultant within the Department of Health might have. So this legislation does not remove the power of the Director of the Health Department, nor does it remove the fact that there is a physician medical consultant that also has a weigh in on the protocols and the rules and regulations.
There is language, as I'm looking at the bill, that seems to shift approval in several spots from the Director of the Board of Health to the approval of the board. And so is there something specific, or there's something we should know about that we may not know about as a committee that would have driven the board to recommend language that would make that shift?
So as Senator Lombardi had stated, in January, the protocols were released without knowledge of the board. So as the chairman of the board, I asked the health department at our March meeting for an explanation of why they didn't ask the board for their opinion regarding the protocols, and what they felt what the role of the board was in the production of protocols and regulations And basically, we were told that they couldn't render an opinion on us or for us until June. So it appeared, based on their comments, that they weren't looking to work collaboratively with the ambulance board.
And therefore, you felt it was important to establish legislation to shift the authority from the Department of Health to the board?
I believe some of it was the stakeholders involved.
So it wasn't just that March meeting, it was other incidents that felt it was important to make that shift?
Yeah, so over the past, like I said, over the past probably decade, that at least that I've been involved with on the board, probably every couple of years there is an issue where this comes up and it gets called to task, and normally through the director's office, usually it's resolved. And in this case, they were not able to provide an answer to us as to why they would go completely around the ambulance board in the production of these protocols. And when the protocols were released, as Senator Lombardi had stated, one of the main protocols that came out was an immunization protocol that directly reflected and was able to help in this pandemic. However, when it was released, it didn't allow for EMTs and advanced EMTs who are able to provide intramuscular injections to allow to vaccinate. And, so after the protocols were released, and there was lots of concern regarding that, because at the time our mission was to vaccinate as many people as quickly as possible, why would we eliminate any part of our workforce that was licensed already to provide these injections? And then in February 15th, I believe it was, after some pressure, they were able to amend that to allow what for many of us was common sense.
Any other questions for Mr. Potvin? Thank you for calling in on both
Chairman,
pieces of
thank you very much.
Yep. We're still on Senate Bill 385, or we're going back to that. We'll finish the rest of 860 after a few more calls. The next call should be Dr. Catherine Cummings. Dr. Cummings?
Hello?
Go right ahead. I believe you called in to discuss Senate Bill 385.
Yes, I did.
Go right ahead.
Thank you. I'm Catherine Cummings, and I'm president of the Rhode Island Medical Society. I'm also a clinical professor of emergency medicine. I'm calling in support of Bill 385, the Rhode Island Medical Society, the Rhode Island Chapter of American College of Emergency Medicine, and the American Heart Association, amongst many other organizations, support this bill introduced by Senator Goodwin. This critical bill, as Mr. Potvin rightly stated, would ensure that all dispatchers at the state 911 center are trained and certified in emergency medical dispatch, and that they are prepared to provide telecommunicator CPR or TCPR in a medical emergency. In other words, the dispatcher helps the caller begin life-saving actions like CPR, even if the caller is not previously trained. Equally important, the legislation also establishes a comprehensive call review and quality improvement program. All in all, I definitely agree with Mr. Potvin on the statistics. 70% of out-of-hospital cardiac arrests occur at home, and another 20% occur in public settings. Sadly, only 10% survive unless there's bystander CPR. Essentially, this very simple maneuver can save lives, and the best way to do it is by having trained dispatchers be able to start those protocols for this and other life-saving maneuvers to do the simplest things at home before the EMS can arrive and do defibrillation. So the EMT certified communicators are trained to assess the situation identify a cardiac arrest, and to provide the TCPR instructions until EMS arrives. I agree. This should be the standard of care for every 911 telecommunicator that provides dispatch instructions for medical emergencies. The General Assembly restricted 911 fees collected on phone lines to fund E911. I very much believe that one of the most vital uses of these funds is to provision EMD and TCPR protocols and fund them fully. Thank you very much. We recommend the passage of 385.
Any questions for Dr. Cummings from the committee? Thank you for calling in.
Thanks.
Next, Megan Tucker from the American Heart Association on 385. Ms. Tucker,
Yes.
go right ahead. I believe you called in for the on behalf of the American Heart Association on 385.
Yes, thank you, Mr. Chairman and members of the committee. My name is Megan Tucker, and I'm with the American Heart Association. And I'd like to thank Senator Goodwin for her leadership on Senate Bill 385. I will be brief because I know you already heard from the medical experts. I just wanted to touch on the cost of this bill. The committee may recall in 2019 there were media reports of 2 tragic deaths. Despite calls to 911, correct CPR instruction was not provided in either case. An investigative report found serious gaps at the state 911 center. That year, the General Assembly allocated funding in the FY20 budget to train and certify all dispatchers at the state 911 center in emergency medical dispatch. The General Assembly also restricted 911 fees on phone lines to fund 911 moving forward. So you've actually already paid for this bill. There have been delays in implementation, which is why we believe it is imperative to codify this life-saving requirement in state statutes. So we thank you for your consideration, and we hope that you will recommend passage of Senate Bill 385.
Any questions for Megan from the committee? Thank you for calling in.
Thank you, Chairman.
I believe that's all the testimony on 385. And next we would move to Jordan Goyette. So Jordan?
Yes, hello.
Hi. I believe you've called in to, on behalf of supporting both Senate Bill 493 and Senate Bill 714.
That's correct.
You can go right ahead.
All right. Thank you very much for the time, Chairman Miller and members of the committee. I'll start on 714. I really appreciate you introducing this measure, and I'm someone who would be, this would benefit, as I was first diagnosed with my own condition that would be protected by the bill in case of an emergency. I first was diagnosed with it in 2013 during my senior year of high school, and I remember how initially the condition really affected basically almost any activity of my daily life became conditional, whether there was a restroom easily accessible, if I would be able to quickly exit a meeting or something like that. I skipped out on dates, family gatherings, school trips, and so I would really urge passage of this bill. The House has already done so. Back in March, they passed it unanimously. So I hope the committee and the Senate does so as well. And moving on to S493, Senator Oyer gave a really great explanation of why this is so timely, especially as this was posted for hearing on Friday when the Attorney General was set to release a really scathing report of Prospect's proposed transfer of ownership for Fatima and Roger Williams Medical Hospital, and they after he initially just asked that they prove their financial viability, they decided to have a tantrum and threatened to close up shop and leave the state, which he then properly called their bluff on. And then they sued to stop the release of the port. So this ongoing saga obviously really demonstrates why this bill is so needed, why the representation on the Health Services Council needs to be expanded with more public representation, why the disclosure provisions need to be strengthened in the Hospital Conversions Act, especially given how shady this company has been. And I'm glad Senator Oyer mentioned that this effort started when Memorial Hospital, before it ended up being closed. I mean, that was the hospital I was born at. And I mean, so like, what's been going on with this company is just very concerning. And that's why especially the provision is needed in this bill that says if there's any misrepresentation of any disclosure of information, that the application automatically becomes summarily rejected. And so I think the AG has done his due diligence in standing up to corporate takeovers of our healthcare, and the General Assembly should follow this lead. So I thank you for the time. I by no means claim to be an expert on the topics, but I'd be happy to take any questions.
Any questions for Jordan from the committee? I want to thank you for calling in on both 493 and 714.
Thank you for the time.
You're welcome.
Have a good night.
Yep. So I believe the remainder of our testimony is all on Senator Lombardi's bill 860. And the first person listed to try to call would be Brian Daniels from the Rhode Island League of Cities and Towns. Mr. Daniels? Mr. Daniels?
Yes, Chairman. How are you?
Good. Go right ahead.
Great. Thank you, Chairman Miller and members of the committee for the opportunity to testify. This is Brian Daniels. I'm the Executive Director of the League of Cities and Towns, and I'm calling in support of Senate Bill 860. Would like to thank Senator Lombardi for introducing the bill, and as he mentioned, bringing together the League, the fire chiefs, firefighters union. We're all in support of this legislation. And really, as I won't repeat what Chair Potvin said, a lot of this is codifying the general practice of what the board has done historically. He mentioned the case, the most recent case of a proposed rule that did not go before the board. But I also want to remind the committee of a situation that occurred a few years ago, coming EMS regulations out of the Department of Health. So as you may recall, in 2018, the Department of Health proposed a rule change for emergency medical services, specifically transportation. It would have required hiring new positions, and I believe it would have authorized the emergency medical director to have budgetary and staffing oversight authority over municipal personnel. It also established new standards for ambulances. So when this was proposed, we asked if they had done a fiscal note, as they were required to do under law. They had not. The Division of Municipal Finance did one, and a conservative estimate found that it would have cost $900,000 per year, and that is just on the cities and towns. That's not for the private ambulance providers. So we then reminded the Department of Health that under the state's unfunded mandate law, they cannot pass regulations that have fiscal impacts on municipalities until the next fiscal year. They have to delay implementation. And in consultation with the Department of Health, they ultimately ended up removing the unfunded mandates. So that's what prompted the bill 2 years ago that the chairman referenced and Senator Lombardi spoke about, to add a municipal representative on the Ambulance Services Board, because this is something
Brian,
that...
I've just one question based on what you just went through. Seeing as we just went through a pandemic, Would there be a situation where you would want not to wait a fiscal year and it's some kind of health emergency?
So that's a great question, and they have the authority. So the Department of Health and all executive agencies, my understanding is they have the ability to issue emergency rules. They are limited in time and would not be subject to those other standard requirements, particularly if there's an emergency order, an executive order in place. So that the intent is not to jam up the Department of Health during a pandemic. In fact, I'd like to, to that point, Chairman, you had mentioned the emergency room doctors receiving patients from the ambulances. One thing that we found during the pandemic is that early on last spring, when the cases were skyrocketing and there was not sufficient PPE for our EMS personnel and our fire personnel and police, one of the things we had worked with the Department of Health on is making sure that Public Safety Dispatch could know who had tested positive for COVID in a household. It took them a little while to pull that information together, but ultimately, because the Department of Health worked with EMS and worked with cities and towns and public safety personnel, they were able to provide that information, and they made a better public health outcome because of that collaboration. And that's why we want to make sure that collaboration continues through this board.
Okay, thank you.
So just going back to the 2019 case, that was when the Senate passed legislation adding a municipal member, and Mayor Policina will be speaking on that. He is the municipal designee. He was appointed by the Senate president. So he can talk a bit about his role on that. But our main concern is that we don't have another repeat of what happened in 2018 when the Department of Health would bypass the board entirely and have a substantial unfunded mandate on cities and towns. That's one of the reasons we support language in Senator Lombardi's bill that requires a fiscal impact statement, a financial analysis. We should make sure we know what the cost of these regulations are. So that's why we support that provision and the underlying bill. So that's pretty much our position. I'm happy to take any questions.
So, consistent with my concerns that I brought to both Senator Lombardi and Mr. Potvin, have you discussed or do you feel like it's important to discuss before we further consider this bill to end up in a place where you don't have the type of opposition that we seem to currently have from both the emergency room physicians and the Department of Health?
Yeah, I'm curious. I will listen to the testimony. I have not heard from the emergency room physicians. I will listen to their testimony and certainly listen to the Department of Health. When we had the proposal 2 years ago, I do believe the committee made some adjustments based on feedback, and we're certainly open to that. I think the most important thing, though, is that whatever regulations come out reflect all stakeholders, and that it is not just one group of stakeholders that gets to dictate to everyone else. That's what Chair Potvin was suggesting. We have a board that has a very diverse population. We want to make sure that all of those voices are heard in any regulation that comes out.
Yeah, I just think that inevitably by their character and their profile that both the Department of Health and the emergency room physicians, if they have concerns, I believe they should take a higher precedent than other people's concerns.
Well, I'm certainly looking forward to their testimony, and we'll see what we can do.
Okay, thank you. Any other questions from the committee? For Brian? Thank you for calling in. Mayor Policina?
Yes, I'm here.
Go right ahead.
Great.
You can go right ahead.
How are you,
You're on
Mr.
with the
Chairman?
committee.
Can you hear me, Mr. Chairman?
Yes, we can. Go right ahead. You're on with the committee.
Great.
Thank you, Mr. Chairman and members of the committee. I want to thank you for allowing me to speak today on this very important issue. First, let me say that I'm not giving you my job resume to look for a job, but just so you know that I have an extensive background in EMS. I was a firefighter for almost 22 years. I'm also have been an EMT for many years. I also teach EMT at the community college and Rhode University. I'm also a registered nurse, and I have a master's in education. So I have a background in EMS, as I've been doing a long time.
And in legislation, as you were formerly a state senator.
Oh, that's right. I forgot about that. And that's the most important one, Senator. You're right. I was a former state senator. And I give you, ladies and gentlemen, a lot of credit for being up there during the pandemic. We appreciate you still fighting and helping the people of the state. With that said, so there's a couple of other things, Mr. Chairman and members of the Senate, that haven't been mentioned that I have to mention. First and foremost, as I said, this bill no way will impede the Director of Health's work when it comes to a pandemic, when it comes to anything. I was on the ambulance board years ago when I was put on, and basically that board, for the past 50-plus years, any changes that came through were run through the board. The chairman of the board would put it to the appropriate committees, and of course it would be vetted properly and publicly, and then of course the full board would vote on it. So I think what we need to know is there's a couple of physicians that are in this to make money, and please let me say this. So a lot of these physicians, especially a couple of them that, in fact, one's on the board, they've increased their strength, if you will, by having these different changes, because what they do is they pick up little part-time jobs here and there. We have a medical director for the Johnston Fire Department who doesn't charge us, but let's say there's one physician who has made this a part-time, basically a windfall for himself. And of course, they're deathly afraid that, because at one time they tried to force different things on the cities and towns, and as the appointment coming from the Senate President and the Senate, we had stopped it. We're not looking to stop them. We're not looking, there's 25 members of the board. There's a vast array of people who represent the 1,050,000 people, and the decisions are made obviously in conjunction with the Department of Health, but also with the public health and safety in mind. The problem is, Mr. Chairman and members of the committee, there are a couple of three people with agendas that are coming from the Department of Health that keep putting things out there that's going to cost money without a fiscal note. And I know, it's not about money. I know that, but you can't just keep throwing things out there. As I said, the problem is, we always vetted everything, and as I said, the board always made the decisions. It was always the ambulance service coordinating board. And for some reason that was changed. I was on the board for about 15, 16 years, way back in the 70s. And we have members of the board, just so you know, Mr. Chairman, and members of the committee, from the Rhode Island Association of Fire Chiefs, Rhode Island State Firemen's League, the Kent County area, the Newport County area, Providence County, Washington County. We have obviously a couple of physicians that are on. So everything would still be transparent. This is no way that's going to take the power away from the director. The problem is, in the letter from the emergency room physician, I don't think that they got the proper information. I believe, and as some of you on the committee may know, I'm kind of cynical. I believe that this is something where they're going to be concerned, because these physicians who are picking up these part-time jobs and kind of browbeating the cities and towns that you need us as a medical director, it's going to cut into their fiefdom that they currently have. So this legislation, I think, goes a long way in basically making things fair, if you will, and transparent and open, and doesn't have one or two individuals making decisions and just saying this is the way it's going to be. If that's the case, Mr. Chairman and members of the committee, you might as well abolish the ambulance board then. Because what's the sense in me staying on there and the other 24 dedicated members staying on there if we're just going to get things rammed down our throat without a hearing process? And as I said, they've never come up with any fiscal note. It's just, you just do it, because they love spending other people's money. And as I said, that's something that we really have to look at, because this is an important piece of legislation. And I know that people are yelling the sky is falling. I swear to you, it's not what it appears to be. This is something that's very concerning. Obviously, There are a couple of physicians on the board that have an influence with the director of the Department of Health. And as I said, there's a couple of doctors that basically they browbeat these communities and say, you have to hire me as a physician, and they end up getting hired as their medical director. We have a medical director in the town of Johnston that oversees my EMTs and my EMS division that does not charge us. These guys got their own little part-time business. It's a nice gig if you can get it. 15,000 here, 20,000 here. This bill would prevent those individuals with an agenda from usurping the board's powers, if you will, and let things go to the full ambulance board after it's vetted. We have a very competent chairman who does a great job. He's very fair. He was on earlier, I believe. And as I said, to me, I could tell you, Mr. Chairman and members of the committee, if I pull those 25 members with the exclusion of those doctors, those greedy doctors that are on there that are making money, and I won't say their names, that we probably get at least 18 to 20 people saying that they agree with this. This is something that's kind of insulting where we sit on the board. We, obviously pre-COVID, people would meet, we'd sit on the board, and all of a sudden they're saying, here, this is going to happen whether you like it or not. So this, and I promise you, as a former state senator, to my colleague, this in no way attenuates the power of the director of health. No way. The director will always have the last and final say. As I said, we just want to be, as I said, as a board, we want to be respected, but also we want to be able to vet these things, not just kind of stick it down our throats. So this is important, as I said, for the state. It's important for the stakeholders, which are the obviously the 1,050,000 people. So I'm hoping that, I got to give the doctors credit. They did, some of the doctors who were going to lose money, they did create mass hysteria with everybody over the past day or so. So, as I said, since '75, the board has always voted, obviously making the final decision. And quite frankly, the board has never really refused anything that the Department of Health wanted, within reason. I can't tell you enough, Mr. Chairman. There are people on this board, certain individuals, and some from the Department of Health that have an agenda. And the agenda is, quite frankly, so you have to understand, Mr. Chairman and members of the committee, all of your cities and towns, most of them have advanced EMTs or EMTCs, and those men and women are putting their lives on the line every day with COVID. They've done one heck of a job. And I think it was mentioned earlier, and I don't think it was noted who really stopped it, but these people with an agenda put through that only paramedics could inoculate, if you will, or vaccinate people with COVID. And by the way, if CVS is across here from the town hall, so if someone gets a shot from a pharmacist and that patient goes into anaphylactic shock, it's going to be my advanced cardiac members, firefighters, that go there and start an IV and obviously intubate and take that person out of the anaphylactic shock. That being said, the agenda was to just have paramedics give the shots, and thank God that Governor McKee stopped that. And I don't know why they tried to do that, because those EMTs that are in your districts, ladies and gentlemen, the EMT cardiacs, the firefighters, they're out there every day. And I can tell you in my case, I had my firefighters during the peak of COVID going anywhere from 18 to 20 positive COVID cases a day. This is when I get here at 5:30 in the morning and listen to the radio, being the Public Safety Commissioner, until 5 o'clock at night when I leave. So that being said, please kind of let the mass hysteria go down, because I understand, listen, senators stick together, firefighters and doctors stick together. And I know this is all about, we have a thing in EMS, it's called ABC, and it stands for Airway Breathing Circulation. In this case, Mr. Chairman and members of the committee, this is ABC. This is all about cash for these doctors to obviously get their, make their little, they got their little fiefdom. It's a great deal if you can get it, by the way. So, as I said, this codifies the board's past practice of making any and all changes done in an open, transparent process. We will never, ever put the public in danger, even with the pandemic. And I know, Mr. Chairman, you mentioned about that, we take people to the physicians and these physicians are against it. I think if you talk to a lot of the physicians and you find out, or if they find out the truth, that this really doesn't put any, we're not going to roll back programs, as was said, that we were going to roll back programs. We would never do that. I've been doing this since 1975. We would never roll back any of the current programs. This basically, I don't want, maybe it's a poor choice of words, it kind of those 3 to 4 or 5 people that have an agenda, this kind of puts a leash on them, so to speak, and it prevents them from just sticking things down our throats. And unfortunately, you've got board members that are dedicated men and women from
So I have a question to you about the, can I pause for a moment to ask you a question?
Yes. I'm sorry. Yes.
So you just said about 3 to 5 physicians that have, where they're also hired to work for cities and towns as a medical director, right?
Correct. There's actually, quite frankly, there's 3 to 5 individuals that let me strike that. There's really 2 doctors that have been pushing the so-called. As a matter of fact, we used to have it where if we had a doctor could be obviously a medical doctor. Well, they changed it as a medical director. Of course, they changed it.
So my question and my concern is the letter we got from the emergency room physicians. I think they represent, and I've heard, I sit on the governor's overdose task force. I've done legislation and worked with emergency room doctors. And, I believe they represent a couple of hundred emergency room doctors in the state. And their concerns seem to be wider than these 3 to 5 people that you say are all about cash. They have a little fiefdom, that they're greedy. I've worked with these emergency room physicians on a lot of protocol. I helped develop the emergency room discharge planning legislation, and there was a lot of collaboration. And I don't believe any of that collaboration was the 2 to 5 people that are part-timing doing something else. And I don't believe any one of them was all about cash. I just wanted to make that clear. And
if I may, Mr. Chairman, what are their concerns? I mean,
I'll be happy to share the letter with you. And my concern as chair on the way I try to get things done in this committee is that when I have letters that have that much concern, whether it be from the emergency room docs or the Department of Health, which has serious concerns, and I'm sure you've gotten that letter. If not, I'm sure you will soon enough. But my concern is it's very difficult to pass legislation until I know that those who are impacted, whether it's current board members or the Department of Health or emergency room physicians, who to me all seem to have, a lot of concern about any board and how it operates, especially one that interacts so closely, that I would like to know that they had discussions and at least some effort was made to read their concerns and address them, or at least attempt to address them. And over the years that I've been a senator, I don't think I've interacted, and I don't think I feel like I'm attempting to represent or understand the concerns of those 2 or 3 people that you characterized as all about cash or part of a fiefdom or greedy. I don't think we're trying to address their concerns. I think we're really trying to address and make sure that you've had a thorough discussion and address the concerns of the other 150 to 200 emergency room docs.
And I think also, Mr. Chairman, that I think if, as I said, they created mass hysteria with this, I think if the ER docs really saw that technically all this is doing to the board, if that's the case, then you might as well abolish the board and let the emergency room physicians run the board or set policy and procedures.
That's not what I don't think that's their objective at all. I think their objective is public health, and I'm sure that's what the objective of the board is. And that's why I see the problem is I see your objective as a board and emergency room physicians and the Department of Health. I see their concerns aligned. They're all 3 entities. Concern is public health above all others. And to have some so seriously concerned with the way the legislation is currently written and others advocating very strongly for it, it's just something I would like to see settled.
Well, I understand what you're saying. Sometimes, obviously, compromise sometimes works wonders.
Yeah.
However, once again, the stakeholders at this are obviously the 25 board members. And as I said, I believe that those emergency room physicians were given the wrong information from these so-called people that have their own little, their little gigs going on, so to speak, Mr. Chairman. And let me say this, as I said, years ago I worked in an emergency room. I respect emergency room physicians. I think if they found out that basically all this is gonna do is not gonna take any power away from the director of the Department of Health. It's gonna basically codify what the board did for the past 50 years that somehow mistakenly was taken away from the board. So it's not something where we're gonna put people's health in danger. Absolutely not. There's no way that I would allow that to happen.
Would it be an honest assessment, though, to reiterate what I said, that all three entities, I think the priority of, minus the three people you talked about, their priority is public health, right?
Absolutely.
Right? And so if you look at the language of the bill, about 80% of the language of the bill is you're moving the authority. It's all subject to the approval of the board.
No.
Rather than the director, is about 80% of the language in the bill.
No. I honestly, Mr. Chairman, we are not removing the authority of the director. I would never do that, no matter who the director was. We follow the leader of the director. These are a couple of individuals, and quite frankly, all due respect, sir, one of them works at the Department of Health in the EMS office, who has their own agenda, and they want the power to control everything. And basically, as I said, what happens then is the ambulance board might as well just stay home when there's a meeting, or it would be best for the General Assembly to dissolve the ambulance board. I'm not advocating that, but it would be no different if the Senate was bypassed on a bill and the House bypassed them, and all of a sudden you're looking and obviously you say, hey, what the heck's this all about? Why didn't you run it by the Senate? That's the problem, Mr. Chairman and members of the committee, that there's a few people, and I know it sounds crazy, but there's a few people that have an agenda, obviously. Some work in EMS, and some obviously are on the board. And quite frankly, Senator, I'm being dead honest with you. They're in cahoots, and their theme is.
So if the issue is this bill seems much broader than those 3 or 4 people that might be in cahoots. So if the bill is that broad, wouldn't it be more appropriate if everything's working well, the no vaccination changed based on the board's action? Wouldn't it be more appropriate to directly address the 3 or 4 medical directors rather than the whole systematic approach of the legislation?
Honestly, sir, the vaccinations had nothing to do with the board. I'll just repeat that. So these couple of individuals from the Department of Health came out with basically an order stating that it would only be paramedics that are administering the vaccinations for the COVID-19. It was Dan McKee, Governor McKee, who got involved when I said to him, listen, you've got like 2,000 EMT cardiacs that can do the job and get this done. If we just had the so-called paramedics do this, quite frankly, we'd be at like 20%. And I just think that these individuals, they want the board silenced. They want to be able to come in with their rules and say, here, we want this next. So I will say this, as far as the board goes for the vaccinations, it wasn't the board that made the change. It was Governor McKee who basically did, I believe, an executive order, if I'm not mistaken, sir. And he's the one who said, listen, if these firefighters are out there every day, these men and women are out there every day going on COVID calls, okay, and they're resuscitating these people that unfortunately die of COVID, then they can surely give a vaccination in the arm. So that's how that. But keep in mind, Mr. Chairman, it was a couple of members of the Department of Health and a couple of these docs that kind of got together, and then all of a sudden we found out, well, now EMT cardiacs can't give shots. See, there were 3 levels out there, sir. There's the paramedic, there's the EMT cardiac, and there's the basic. My theme to Governor McKee was that there's no reason why the EMT cardiacs or advanced, they call them, the names are used interchangeably, can't give the shot. And I explained to him the situation, and he agreed. As I said earlier, I gave that scenario where CVS, they're given a shot, the person goes into anaphylactic shock, collapses, goes into respiratory arrest. It's my EMT advanced cardiac. They're going to obviously get on scene, intubate, give obviously life-saving drugs, defibrillate if need be, and save that person. So they were sure, if they're qualified to do that every day, they are surely qualified to give the COVID-19 vaccines. And that was stopped, sir. That was stopped by these individuals on the Department of Health. Okay. It never went through the board.
Is now a good time to see if other senators have any questions? Senator Bell, I think, has a question for the mayor.
Sure. Senator.
Yes, thank you so much, Mr. Chairman. And one of the things that really struck me about your testimony, Mayor, is that you mentioned that previously the board had actual executive authority and the ability to vest actual executive authority. I want to make sure I caught that right, which makes me think that the whole reason why it no longer does probably is separation of powers, because constitutionally the board can't be constituted as it is with all these things in the law specifying who's going to be on the board and without going through the Senate for advice and consent. So I'm wondering if you'd still support the legislation, understanding that it would eliminate all these rules around the constitution of the board and essentially allow governor to pick whomever the governor wants and have it all go through the advice and consent of the Senate.
Well, if I may respond through the chair, well, I understand what you're saying, but the board never really fell into the separation of powers, which is something I think I was never, when I was a senator, I was never for that, because basically you're usurping the powers of the senators and reps who work hard every day and having the governor make all the decisions, which to me that's a dictatorship, but that's another story. So it was just for some reason, Senator Bell, it was just taken away from them, and you know, sometimes people kind of go along to get along, and I think before you knew it, the board was saying, hey, wait a minute, you're jumping ahead of us over here, and you're putting stuff before us saying, this is going to take effect on June 5th, whether you like it or not. This is going to happen. So as far as separation of powers, that's a whole different story, Senator, and I understand exactly what you're saying. Separation of powers is a panacea. I think it sent the wrong message to the public saying that everything was going to be fine, but I still believe that the senators and the representatives that we elect and we obviously have our faith and trust in should be actually appointed to the boards and commissions like it once was years ago. So I hope I answered your question, but this board, for 50 years, really, it was policy that the ambulance board would, if there was a change, a protocol change, a procedure change, it would be presented to the board, and the chairman of the board, whoever he or she would be, would disseminate that to the appropriate subcommittees, if you will. It'd be an open process. The subcommittees would have meetings, post our meetings, and then we'd bring it back to the full board for an up or down vote. And I don't remember voting against, when I was on, anything against anything that had obviously that had a positive effect on people's health. And that's not what this, and I got to say it again, that's not what this bill is about. I really truly believe that, and I got to give a couple of these doctors who were making money, I got to give them credit. They created mass hysteria. They really did. And it is what it is. Now it's up to people like myself. And just so you know, that I represent the League of Cities and Towns as a board member. And also, Mr. Chairman, I know you said that they added 2 firefighters. No, it was myself, sir, and it was one other firefighter that was added that the Speaker appoints. But I'm appointed by the Senate President and, of course, the Senate. So, and I appreciate that, by the way, for you, all of you on the committee and the other members putting their faith and trust in me. So, to you, Senator Bell, I hope I've answered your question. I didn't mean to interject with my personal issues about separation of powers. I'm not a big fan of that. But the board never really I don't think the separation of powers affected the board per se. The board just continued to operate. It's no different, I would say, than things like other boards that you have. Is it the board that oversees coastline, coastal resource management? I mean, they make the full decision without the DEM director saying this is the way it's going to be. So it's kind of similar to that and the other boards that basically, they follow open meetings, follow procedures, follow protocols, and they make the ultimate decision. And I can tell you this, Mr. Chairman and members of the committee, I can tell you, I wish I was there to look you in the eyes, it will never happen where this decision is going to be made where we're going to have an issue. I hope I answered your question, Senator Bell.
Senator Bell, you can go again.
Thank you so much. I just want to briefly say, I think that the example you brought up of the Coastal Resources Management Council is a great example. My understanding is after the passage of separation of powers, the Coastal Resources Management Council lost all of its requirements that the specific all the specific requirements around who was appointed. And there was some controversy over this a couple of years ago, where a number of activists said that they were concerned the board was constituted illegally. But the governor said that actually, because of separation of powers, all those restrictions and limitations in the statute on who can be appointed are therefore unconstitutional. And so all of the political negotiation around the exact composition of the board, with making sure that there are representatives of municipal elected officials in coastal communities and things like that, that all went out the window. And it's my belief that passage of this legislation would do exactly that to this board. And it would remove things like giving the Senate president an appointment. And I think that in order for the board to remain constituted as it is under separation of powers, now I agree with you. I think separation of powers has problems. But I think the practical effect of passage of this legislation would be to deconstitute the existing board and have Governor McKee simply appoint whomever he wants, subject to advice and consent of the Senate. I'm not saying that that would necessarily be a bad thing, that Governor McKee would make bad appointments or that we would approve bad people, but I think it's important that people understand that's what this bill does. And I think it sounds like from your testimony, probably the reason it was changed to just an advisory board was separation of powers. So I do think it's really important to understand that constitutional component of it.
I appreciate your comments, Senator. Thank you, sir. Mr. Chairman, I'd be glad to answer any questions that the board may have.
Any other questions from board members? I mean, from committee members?
Sorry about that, Senator.
For the mayor?
Yes, sir.
I think we'll move on.
Thank you very much to members of the committee and Mr. Chairman. I appreciate it, and as I said before, I really appreciate you allowing me to testify, obviously in favor of this legislation. I also want to thank Senator Lombardi for putting it in. It's a very, Senate Bill 860 is a very important piece of legislation, I think, for EMS, emergency medical services, and the pre-hospital care providers. So I thank you, sir.
Yeah, I think it's important to get, I know that emergency room doctors in general, and the Department of Health as a commitment, and yourselves as members of the boards and firefighters are all committed. Their commitment is all aligned. That's why I would like to see, further discussion between the parties so they can come out, with some kind of agreement with that goal in mind, that public health is the priority.
I understand, Senator. As I said before, I think, there was some mass hysteria created with this.
Yeah, we didn't hear from them. I can only speak for myself, but nothing from those doctors, or it could be traced back to those doctors, is in either who we're going to hear from or, in our letters on this specific legislation.
No, they just so you know, Senator, they contacted, obviously they're members of the emergency room physicians, so they contacted their leaders. So obviously, I think they created some panic and didn't give them the true story. And these are the people, as I said, that have their own little fiefdom that are making money here and there. And we also, I'll just leave it as that for now.
Okay, thank you.
And I have no problem talking to them. So
great. I think the next call we have coming in is from Chief Partington from the Association of Fire Chiefs. Chief Partington?
Yes, this is Chief Partington.
Go right ahead.
Thank you, Mr. Chairman. Thank you for taking my comments this afternoon, and also thank you to the committee members. So I'll try and keep it brief, especially after following the good mayor there. Senate Bill 860 is what I'm looking to give comment on. First of all, I'm the fire chief in the town of Narragansett, as well as current president of the Rhode Island Association of Fire Chiefs. I am currently an active Ambulance Service Advisory Board member, have been since 2017. Been actively involved in the committee level as well, which is where a lot of the discussions related to some of these proposed changes usually occurs. So I just want to say that it's not the fire chief's desire to sacrifice any competence level at all or nationally recognized professional standards when it comes to delivering EMS professional care services to our community. It's quite the contrary. We're always out there wanting to improve and raise our standards and live up to those standards. But we need to remain part of the discussions when it comes to implementing new regulations, fees, protocols, delivery models, and any technologies, especially those that will inevitably affect or impact us financially here at the local level. The fire chiefs and EMS administrators need to be made aware of essentially of how their budgets will be impacted when it comes to these changes. So when we propose new standards relating to the mandating of supplies, medications, new regulations, protocols, adjusting or changing any of the fees, and even administrative changes, it helps to make us aware of those potential financial impacts that may occur. So we try very hard at the committee level and the Ambulance Service Advisory Board level to inform those that we are representing, so we can trickle that down to the local level. As it's brought up, the Ambulance Service Advisory Board, it's made up of a 25-member board, quite a wide range of professional representatives. As Potvin had mentioned before, there's, I believe, at least 4 physicians that are on the board, as well as other medical professionals. And we have had some very engaging debate along the way. Certainly, we've had that at the committee level. And we are just looking to ensure that that continues. We're looking to avoid those unilateral kind of sweeping changes that are made to the protocols or the regulations without any serious debate at the board level. We just don't think it should occur. No matter what the intent, we just don't think it should occur. This does not mean we're looking to sacrifice or improving upon our delivery services. Again, it's quite the contrary. Again, we're looking to improve upon it. I will say previous debate that's going on regarding the rules and regulations on EMS and the current rules and regs that have been promulgated were the result of much discussion and debate at the committee levels, particularly as it related to definitions, policy changes. It was brought up as an example of the medical director's role. We had significant debate over the language around the medical director's role. I'll be quite honest, the fire chiefs were insistent upon having the medical director be an active member of that EMS agencies or that organization's agency. But it came down to outlining the criteria for it by that chief officer or that chief administrative officer of that department to make that determination. The insurance was just that the medical director would have a role, that they would be actively involved with that organization and not just signing the application or the refresher application when it came to renew. And then we had significant debate about that, and we managed to work that out. And that's just an example of some of the things that happened at the committee level, and we brought it to the board. Other policy changes when it relates to the use of lights and sirens, which was good. We had some debate, believe it or not, about the use of lights and sirens for non-emergent calls. Infection control policies, substance control policies, quality improvement programs, which are vitally important. Medical directors, they're there to help us. They're there to be used as a resource for us. They shouldn't be shunned. They should be welcomed. And having that definition within the rules and regulations requiring it to be medical director, I think is important. So it's just an example of some of the debates that we've had along the way. And if I can just put another plug in for the fire service in general, The fire service remains the primary delivery agent of pre-hospital care services in Rhode Island, and I think it will be, and it will continue. During this most recent pandemic and the state emergency that occurred, it became clear just how important and valuable our fire-based emergency medical service delivery model can be. So we need to continue with that delivery model. I think it's best for all, but we need to make sure that we're doing the best possible job that we can out in the field. So, and this is just not the position of the Rhode Island Fire Chiefs. It's also the position of the International Association of Fire Chiefs since 1975, that when they first issued an opinion paper in support of fire-based EMS delivery model. So we have the ability to utilize our first responders and firefighters and staff to staff equipment not only for transporting vehicles such as rescues and ambulances, but also for non-transporting apparatus, such as engine companies and squad units, where we have outfitted equipment, trained personnel to get EMS service and care out to those patients as quickly as possible. So I think it's a proven EMS delivery model. We hope to continue it in the future, and we will do anything we can to help improve upon it. And if that means working together to enhance the professional standards and continue to provide the best, highest level of pre-hospital care we can. So again, this debate we're having at the Ambulance Service Advisory Board is not meant to, by any means, dummy down the professional standards or the regulations related to providing EMS care. It's actually just to have a debate and to keep those informed who it affects down at the local level. Continually involved and informed as we go along. So that's where we stand. I thank you for allowing me the time. If you have any questions, I'd be glad to answer them.
I just want to, thank all the guys on rescues who I see, active in downtown Providence and in Cranston, where I live, constantly. The work they've done, especially in the last year, is amazing. But I wanted to ask you what you had a concern in the beginning of your comments about fiscal impact was one of your concerns. Isn't currently, as part of your protocol within the board, that you have to have a cost benefit analysis? Isn't that currently required?
A protocol within the board?
Yeah.
I don't know if that's I'm not sure on that, Senator, to be honest with you. I think what we're trying to ensure is that we do have that, and that's maintained. Yeah. Quite often when these new medications are added, or if equipment is mandated, it's just done without actually taking. Yeah,
I'm just looking at some of the testimony we got says that currently, some of the written testimony that currently there is a cost benefit analysis required for the examples you gave above before there is any action on it.
Okay, well, we're just trying to ensure that continues, and to have it actually physically spelled out, done in writing, documented, so that we can take a look at that and analyze that more effectively would be beneficial for all.
So do you think that's important to actually identify in the legislation to require a cost-benefit analysis?
Well, I do, and as I read the language within the proposed bill, I believe it outlines that within the bill itself, the proposed bill.
Okay, I'll look for that. Are there any other questions or comments from yourself or questions from the committee? If not, I want to...
I have no other comments. No, thank you. Thank you for your time. If there are questions, I'll be happy to answer some others.
Okay. I don't see any questions from the committee, so I want to thank you for calling in.
Okay, thank you, Chairman.
So I believe the next person we're going to hear from is Paul Valletta, who represents the Association of Firefighters. Mr. Valletta,
Yes, Chairman.
go right ahead. You're on with the
Thank
committee.
you.
Yep.
Thank you. This is Paul Valletta representing the Rhode Island State Association of Firefighters. I represent probably most of the men and women who do emergency medical services work in the state of Rhode Island. I'm also a veteran, 35-year veteran of the fire service, and I've been an emergency medical technician at the cardiac level, licensed in the state of Rhode Island for 36 years. I normally don't say that, but I wanted you to know there wasn't some hack talking about EMS services before you, that somebody who's been there, who's been on rescue, and who's done the job. Before I begin my testimony, I'd like to answer a few questions that were asked of the committee. First of all, Chairman, there is no protocol of the board that demands a fiscal note. This is something that the Leagues of Cities and Towns wanted in the legislation, and quite frankly, we did too. There's been several proposals made over the years that would have been cost the cities and towns astronomical numbers, and there were no fiscal notes tied into those. So that's why that's in there. So there is no protocol right now in place for a fiscal note. A couple of things, Chairman, you mentioned, why wasn't there any discussions between the ER docs and the parties? Well, I'm pretty disappointed in Dr. Warren, who I've got a pretty good rapport with. For the last year, Dr. Warren and I have worked together to provide PPE to firefighters, to hospitals. When I got extra stuff, I'd give it to him. When he got extra stuff, he'd give it to me. And he's got my number, I got his number. We've talked during the pandemic. So I was very surprised when I heard the ER doctors were against this, and I didn't get a courtesy from my friend Dr. Warren to call me. I would have loved to sat down with him. I still don't know what the ER doc's problem with this. I'm kind of surprised when I heard they were against it, because they have positions on this board. And if this legislation wasn't to pass, then their representatives on the board mean squat, just like everybody else's mean squat. It doesn't mean a thing. This board has nothing. They don't vote on anything. It all comes from the Department of Health. You also mentioned, you asked a question, Chairman, of someone. You said, I think it was of Senator Lombardi, who said, isn't restricting the DOH bad timing? And I assume you're meaning because we're in the middle of a pandemic. So first of all, this legislation does not restrict the Director of Health. The Director of Health retains all the power she has right now. Nothing changes. Zero. And I would agree with you. This is pretty bad timing. I would love to not be sitting before this committee in the middle of a pandemic, because I've been pretty busy with my firefighters over this last year as we do what we do every day. So I agree this is bad timing. But the bad timing started January 1st of 2021, when the Rhode Island Health Department did something that they've never done over the last, probably since 1973. They instituted protocols without going to the ambulance board. So they started the bad timing, sir, not us. In the middle of a pandemic, you want to change protocols without going to the board. So they started this, not us. A couple of other things I'd like the board to look at. When you get a chance, go look at 23-4.1-3 BC under the duties of the Director of the Health Department. In that, it says that in those two sections, I'm not going to belabor it, you read it. It says the Director shall cooperate with everybody who performs emergency medical services in the state of Rhode Island. I can tell you that has not been the case. I don't understand the health department's animosity towards the people that do this work on a daily basis, but it's been there for quite a while. And this board, I can tell you, I've witnessed this board. I've never sat on this board, but I go to all the meetings and I go to the subcommittee meetings. And nobody can tell me in a profession like emergency medical services work, which is such precise work, and you really have to know what you're doing, and you really have to be dedicated. Nobody can tell me 25 people made up of all different facets of emergency medicine. Nobody can tell me 25 people's opinion, vetting issues and vetting protocols, is better than one person making a decision. I just won't buy that, and I'll never buy it. And that's what we're trying to avoid. This board, and one other thing that Senator Bell said, and much smarter than me when it comes to the Constitution, so I'll defer to him. But Senator and other members, We are not changing anything. This legislation is not changing anything. The board has always voted for protocols. We're just codifying it now in law because for some reason, and only they can answer it, the health department has chosen, now since 1973, we're changing the practice. So we've always voted for this. This does nothing new. It does not take away the director's powers. I think the chairman said it takes away 85% of her powers. It does not do that.
No, I didn't mean it takes away 85% of her powers. I meant if you look at the legislation, about 85% of the blue ink is where there are changes to the current statute, is subject to the approval of the board, to the approval of the board rather than the director of health.
But that's always been, Chairman, that's always been the case. The board has always voted. She is the only one, as the director of health, that can propose a protocol, that can implement a protocol, or rescind a protocol. She's the only one that can do that. As an example, this is an example. If the health department gave us a protocol, gave the board a protocol, and they voted to approve of it, like they always have, and then after they voted, she said, or I keep saying she, but she is the director of health now. Any director of health then says, you know what, I have second thoughts on this. Then that's it. Just because the board voted on it doesn't mean it goes into effect, because only she can implement. She proposes the protocol, she implements the protocol. That's it. She's got the right to do that. And this legislation doesn't change that. That's been in place forever. That doesn't change it. There's so misinformation out there about this bill. It really is a sin. And usually when there's good legislation that comes before you, when the proponents of it can't go after it because it's such a good bill, then they have to make up lies. And that's exactly what happened today with this bill. The opposition from the ER docs, I'm not sure what their opposition is. The only thing I can guess, really, what could they possibly be opposed to? They have positions, they have ER doctors on this board that won't have a vote anymore. So what's the sense of going there? So the only thing I can think of is, do they think that ER doctors are smarter than everybody else and they should be making the decision? I don't know. But I'll tell you one thing. It's much different. And no disrespect to any ER doctor, because I know I'll get in trouble for this. Someone will say I disrespected them. But no disrespect to ER doctors. They save lives. The nurses in the ERs, they save lives. So there's no disrespect. But I'll tell you what. It's a lot easier putting an IV in somebody's arm in an emergency room with the big bright lights over your head, with 15 other people around that bed helping you. Try putting an IV in somebody's arm on your belly in an overturned car on 295 in the middle of a snowstorm. So I think everybody seems to think, unless I'm missing something, and maybe I'm getting too sensitive in my old age, but everybody seems to be thinking about the ER doctors and what the health department's going to think. How about what the firefighters who do the job every day? How about they think? They shouldn't have a say in emergency. They shouldn't have a say. Yes, sir.
Let me just say one thing to try to get us all calmed down a little bit, is that I think that's why you have a majority of the board. You currently have a majority on the board is because you guys are the ones doing exactly what you described. But my only point that I tried to make, and I'm not sure if it's clear earlier, was that you have three parties here who have, appropriately participate in this conversation. And I believe you all have the same thing in common, which is the patient and the public health in general and the best outcome possible. And so what I would like to see, and I think it's consistent with the way this committee is operated, is, any bill, especially a bill with this much input already, would be held for further study and then it would be worked on. I think what would be the better testimony that we could get is the testimony, instead of saying, I haven't heard from them, or I don't know why, is to have, formally meet, and I would be happy to be the person that convened it, where those who are concerned about the legislation and those who have brought the legislation before us on their behalf, that we have a hearing after we've heard this with hopefully a sub-A presented, that we can say, those who didn't know on why people object to this legislation now do, and this is why we're amending it here, there, and wherever it will be appropriate, including fiscal note.
Right, Senator. But, Chairman, but I didn't know the emergency room doctors.
Well, that's exactly what I'm saying. I think
there was no way. And they've all got my number. So there was no way. I mean, one of them couldn't have picked up the phone and said, "Hey, Paul, I think we got an issue with this thing." You know, so I didn't know. I'm not going to start calling people. I didn't know.
You know,
listen, as far as the Department of Health, I know their opposition to it. What they've been trying to do for years, Chairman. They've been trying to nix out the board. We've been seeing that for years. And now they chose in the middle of a pandemic to draw the line in the sand. That's what they did. Listen, they've tried this other times, and you know, we've fought them back. The board has fought them back because we've showed them that in law we believe the board already has this right. They have a difference of opinion. We have a difference of opinion. But now they drew the line in the sand, and that's the reason. That's the reason for this legislation. The health department. I'll sit down with the health department. The health department's not going to compromise on this. And if it is, I'll buy you a steak dinner at Twin Oaks. But they're not going to compromise on this. I would love the chance to sit down with the ER doctors, who I utterly respect. I mean, I did rescue for 10 years, so I brought patients to all the hospitals, and I seen what these ER doctors and these ER nurses do. So I would have loved to have a chance to sit down with them and say, guys, women, what's your issue with this? But they didn't give me that opportunity to do that.
Yeah, so I would say...
I'll close with that. And one other thing, Chairman, you keep saying that we've got the majority of the board. Well, we do have the Rhode Island State Association of Firefighters. Out of 25 members, we've got 3 appointments. So I don't know why you or anybody else keeps saying we got the majority of the board. There are other firefighters on there, but they're fire chiefs, they're medical directors, they're administration.
Yeah, I might be over-categorizing. Yeah.
You were over-categorizing just a tad. I'll give you a pass on that one.
Okay, thank you.
So we've only got 3 spots. So I don't want people to say we're stacking the board here. We're facing fire chiefs and administrators too. So I'll end with that, and I appreciate everybody listening to me go on, and I'll take any questions.
So I feel that I would, I feel almost guaranteed that dinner at Twin Oaks, because the next time we hear this legislation, because there have been recommended changes by all 3 parties that have chimed in on this. So, you know, I believe we will be back with a sub-A.
That's the problem when...
I feel very confident on that dinner.
I know, but the problem is we don't know. You know that, and I know that's the problem of being in a pandemic. And we can't
I was going to bring that up.
One
One of the problems is that because of our schedule this week and throughout the pandemic, there has been no perfect hearing, and this one is an example. This bill was a new bill that hadn't been around for very long, and was not posted until Friday for a hearing on a Monday. So I know we have further people that want to be heard on this bill, and at this point it'd have to be in writing rather than, or in meeting if we convene together. But that's part of the imperfection of what we're dealing with right now.
No, I know, and everybody's dealing with it. No, you're right, because, you know, if everybody's in the same room, sometimes you go in the back room and you talk.
Yeah.
But you can't do that anymore, so. All right, thank you. I'll answer any questions.
Senator Bell, I believe, has a question.
So, I just want to clarify, one thing. Part of the reason I'm raising the concerns about separation of powers is, in fact, to protect you. Because my belief that the passage of this legislation, by making it a board that has executive power, would therefore trigger all the separation of powers requirements that would, in fact, I believe, eliminate the firefighter representation on the board as a requirement of the way the board is constituted. And I'm not sure that's a good idea. So let's just assume, should I be correct that about the effect this would have on separation of powers? And I don't think it's fair to ask you to make constitutional law interpretation. But were that true, if we assume that that's the case, would you still support this, knowing it would be giving up the protections in the law to ensure representation from firefighters?
Well, I look at it this way, that because the board has always had this power, and I think if you go look at those sections I told you to look at, I asked you to look at, not told you to look at, asked you to look at the duties of the director, and some of the parts of the present law, I already think they have this power. I already think the board has this power to do this, to vote on these things. That's just my humble firefighter opinion. So, you know, I don't know if that answers your question or not. But I think we've already got the power to do this.
That in fact wasn't my question.
Listen, and that's why the health department has made us vote on protocol since 1973. Why they picked 2021 to now draw the line in the sand, that's a question you'll have to ask them.
My question was, let's assume that I'm correct about the effect this would have through separation of powers. If that is true, if it is true, knowing that this passage of this legislation would remove firefighter representation from the board, would you still support it?
Yes, I would support anything. Here's what I would support. I would support anything that allows a group of people made up of the medical profession, every facet of emergency medical profession, to have a say instead of one person. I just don't think that's the way to go with emergency medicine, to have one person making decisions.
Okay, thank you.
Thank you.
Any other questions for Mr. Valletta? Thank you for calling in.
All right, thanks, folks.
Yep.
Take care.
We have one other person to testify tonight. I think it's Dr. Otis Warren from Emergency Room Physicians. Dr. Warren, go right ahead.
Hello, can you hear me?
Yep, go right ahead.
All right. Thank you, Senator Miller and senators. My name is Otis Warren. I'm a emergency doc at the Miriam Hospital. I'm also president of the Rhode Island chapter of the American College of Emergency Physicians. We represent 250 emergency doctors who live and work in Rhode Island. We also have a single representation on the aforementioned Ambulance Services Advisory Board. And just as a disclaimer, I'm not an EMS doctor. I'm not a medical director of an EMS agency. I'm a physician representing ER doctors as a whole. I want to briefly touch on a little couple points that were raised. Firstly, by Mr. Valletta, I agree with his assessment that he and I have worked cooperatively on many issues, on legislation, PPE, and everything. I consider him a colleague, as I do all of my EMS colleagues. And the reason I have not been able to contact you is I just found out about this bill last night at around 9 o'clock last night, and was working at the Miriam today. And I basically I go into details why we oppose Senate Bill 860. Can you still hear me, Senator?
Yes, you're coming in fine.
Okay, great. So I think, as you've outlined, Senator Miller, our main opposition to this is essentially the removal of the authority of the Director of the Department of Health, basically in all matters pertaining to EMS services, and allow the board to self-regulate. And I disagree wholeheartedly with the other statements that this won't change anything, because, like you mentioned, the phrase "subject to approval of the board" has been added 8 times to this legislation. That is the majority of the text that's been added in this bill. And the retitled Ambulance Service Coordinating Board would have full final approval of all regulations, protocols, standards used by the Director of Health, licensing fees, restocking, municipal ambulance supplies, and other administrative actions proposed by the director. And again, the board would have complete control over emergency medical services. And there's no other board within the Department of Health that has authority over the director. I mean, the Department of Health is responsible for our public health. I mean, they oversee barbers, restaurants, hospitals, physicians, nurses, licensing, and regulation. And this is unprecedented in this call to action that this bill is asking. As I mentioned earlier, 2 years ago, as I mentioned earlier, 2 years ago, legislation was introduced and passed, basically removed the Department of Health representation from this very board and replaced it with 2 additional appointees who are political appointees. This board, we have one, as our College of Emergency Doctors, we have one appointee to this board. And most of the appointees come from special interest groups or political appointees, what makes physicians a really distinct minority within this group. ER doctors and EMS work together. We're part of the continuum of care in the field of a hospital, and I consider my EMS colleagues, including many of whom you heard from, as close as my fellow doctors, work in the same department. As I mentioned, I've donated PPE to the State Association of Firefighters. I dropped boxes off there earlier, and likewise they coordinated with we really were cooperative during the pandemic. But the problem is on the boots on the ground, and this board and the working with the EMS are basically often at odds. And particularly when it comes to when this board meets, the physician members are frequently drowned out by concerns raised by the small minority of physicians are oftentimes drowned out by majority of the board in areas of particularly implementing evidence-based practices. The case in point being the issues raised over the improper positioned ET tubes a couple of years ago, being a case in point of how good, sound clinical practice can be drowned out by vocal members of this board, and having the minority voice in this board of one ER doctor appointed to this board really plays out in the way this board operates. And this is a digression, but I think I need to address some of the issues made by Mayor Policina about medical directors and this quote-unquote fiefdom of ER doctors that are getting rich off of this. So as Captain Partington said, that medical directors are an integral part of an EMS service. These are not ER doctors that are hungry for a money grab or a fiefdom of people looking for more pay. In fact, an ER doctor can work a single shift and make more money in the single shift than they would make on an hourly basis providing medical direction to any municipality. And it's not a stretch to say that being a medical director impairs a ER doctor's ability to make money. And another case in point about the very issue that was raised about how this is a vaccine, that this came out over the vaccine protocols during COVID. So that what ended up happening, Senator, is that the vaccine clinics were then staffed by EMT cardiacs. Those EMT cardiacs made overtime pay. The ER doctors that were there at these clinics, supervising the clinics, were there on a volunteer basis, working on their weekends off. They made no money. These are the same doctors that are being described as money-grabbing and controlling a fiefdom of ER doctors. Admittedly, Senator, that is a digression because the issue before us is basically the dangerous removal of the Department of Health from having authority over this board. And I agree with Mr. Valletta saying that we need to work together on this more, but the way it stands, the way it's written now, is basically unprecedented and dangerous, and we really have significant concerns about that. Thank you, Senator.
So it's obvious and almost inevitable that emergency room docs at the Department of Health and the fire rescues specifically, because they're the ones who testified, I think, completely on this bill. They're inevitably tied and most often compatibly working with each other. Isn't that correct?
Yes, very correct.
Yeah, and so I know Mayor, former Senator Policina doesn't, I would assume, and I get also the same feeling from Mr. Valletta, that nobody wants anything, including a discussion around this kind of legislation, to have any detriment to that relationship. But identifying 2 or 3 doctors that might be getting paid versus the several that could be medical directors as driving the concerns around this legislation versus the 200 doctors that you represent as emergency room physicians, seems unnecessary to the dialogue around this bill and unnecessary to the process that I hope we seriously set up with Mr. Valletta and others who are going to take me out to dinner after we're finished coming up with some language that all 3 parties can agree to. It just seems like it's counterproductive to what they all agree is the objective, which is, better outcomes.
Senator, as you mentioned earlier, this bill was introduced on Friday, and we're hearing it on Monday. I think this is some of the reasons that other interested parties have not weighed in one way or the other in this is just because of it's how fresh it is. And this was, like I said, not on my radar until yesterday evening. And so I think this is very fast and being kind of pushed through, maybe pushed through is the wrong word, but it's being introduced. And I think what we're going to hear as more people can digest what the implications of this, I think the director of the Department of Health put it very bluntly in her letter, just how important this is. And this having the Department of Health be the Department of Health in this case and be able to implement controls that relate specifically to public health and not have it controlled by a board that is, that would be clearly a violation of, it's not an ethical violation, but a conflict of interest issue that this board raises if it were to self-govern.
So, any other comments from Dr. Warren before we open it up to questions from the committee? The committee, do you have any questions for Dr. Warren? If not, I want to thank you for calling in, and I know the dialogue around this type of legislation will continue.
Thank you, Senator.
Yep. So at this point, that's the last person we have scheduled to call in. We've heard introductions or call-ins or have written testimony on all the bills before us tonight. I would like to make a motion to hold for further study Senate Bill 382, 385, 387, 482, 493, 648, 714, 767, 829, and 860. Is there a second?
Second.
Can the clerk take a roll?
Senator Miller,
Yes.
Senator Valverde,
Yes.
Senator Lawson,
Yes.
Senator Bell,
Yes.
Senator Calkin, Senator DeMario,
Yes.
Senator Golden.
Unmute there so we can hear that.
Sorry. Yes.
Senator Paolino,
Thank you. So those bills will be held for further study, and I expect further conversation around several of those bills. A motion to adjourn?
So moved.
Second
Second.
by Senator DeMario. All those in favor?
Aye.
Aye.
Thank you for attending our special Monday night hearing. We're adjourned.